my name is Catherine Meyer, and today I'm going to do my head-to-toe physical examination on my patient Eric. Eric is a 26-year-old Caucasian male who's come into the clinic today for his wellness exam. He appears in no acute distress or illness. He's alert and oriented to person, place, time, and situation. He appears calm and cooperative. So I'm going to first start off by checking Eric's vital signs. I'm going to go ahead and check your temperature underneath your tongue. Check your oxygen level. Check your blood pressure. You can go ahead and relax your arm. over 81. Oxygen level is a 98% on room air. Pulse is 70. His temperature is a 36.6. He has 16 respirations per minute. Next, Eric, I'm going to have you step on over here onto the scale, and I'm going to weigh you. And then I'm going to turn the camera so we can see what we're doing. So Eric has stepped onto the scale. I'm going to go ahead and zero it. Go ahead and step off the scale for me so I can zero the scale. All right, go ahead and step back on the scale. He weighs 178.6 pounds. Go ahead and step off. And then I'm going to go ahead and then measure your height. So go ahead and stand up here, put your feet against the back of the railing. Go ahead, stand straight up. Head straight ahead. And he is 68 inches. Okay, you can go ahead and have a seat back on it. Next, I'm going to move on to Eric's head and face examination. I'm going to inspect his skin. His skin is pink. His color is consistent with his ethnicity. His skin is dry. I don't see any moisture. His eyebrows are blonde and they're in alignment with each other. His eyes are blue with a white sclera, both also in alignment with each other. His ears, both of his ears look pink. Color is consistent with his ethnicity. I'm going to check the alignment of his ears to his inner canthus of his left eye here, or right eye, pardon me. Alright, and then I'm going to change over here and check the alignment on this side, on his left eye, to his inner canthus. And that's all in alignment, like it should be. Next, I'm going to go ahead and look at Eric's hair and look at his skull. His hair is blonde, it looks thick. His skull does not look like it has any bumps or depressions anywhere, any lesions, none to note. Next, I'm going to go ahead and check cranial nerve 7, which is his facial nerve. So Eric, I'm going to ask that you wrinkle your forehead for me. Go ahead and raise your eyebrows up to the ceiling. All right, clench your teeth as hard as you can. Close your eyes like you're doing too. I'm going to have you go ahead and smile. Frown for me. Can you puff out your cheeks? Can you purse your lips like you're going to whistle? And then can you stick out your tongue for me? Alright, so he passed cranial nerve 7 exam. Next, I'm going to walk around the bed and I'm going to go ahead and palpate his scalp and hair. In doing this, again, I'm going to feel for any bumps, look for any lesions, nodules, any masses that I can see. Again, his hair texture feels thick, blonde hair. Next, I'm going to palpate your facial bones. I'm going to palpate your nasal bridge here. It's deviated to the right. I'm going to palpate your zygomatic process. I'm going to palpate your maxilla and your mandible. No abnormalities noted there. Next, I'm going to go ahead and test your temporomandibular joint. So I'm going to touch right in front of the trachea of your ear, and I'm going to ask that you go ahead and clench your jaw. All right, can you move your jaw side to side for me? Can you move your jaw out and then back in? All right. In doing so, I'm going to look for any clicking, any popping of the jaw, which in his case there was none noted. Next, I'm going to palpate his sinuses. I'm going to start with his frontal. The frontal and maxilla are the only two that you can palpate. So I'm going to go ahead and palpate your frontal. It's going to be right below the brow bone. I'm going to look for any tenderness, swelling, pain. Next, I'm going to palpate your maxillary sinuses, pardon me. Again, there I'm looking for any tenderness, any pain, or any swelling, and none is noted there. And finally, I'm going to go ahead and test your light sensation, which would be cranial nerve 5, the trigeminal. So I'm going to ask that you go ahead and close your eyes for me, and I'm going to use a cotton wisp, and I'm going to touch certain areas of your face, and I want you to tell me when and where you feel the cotton. Go ahead and tell me. You can speak and tell me where and when you feel it.
Feel it.
Where at?
The right side of my face.
Okay.
My chin. Forehead. Left side of my face.
All right. So next I'm going to move on to your eye exam. I'm going to go ahead and ask you to close your eyes for me. I'm going to inspect your eyelids. The eyelids look smooth. The color is consistent with his ethnicity, pink undertones. I don't notice any lesions on his eyes. Next, I'm going to have you open up your eyes, and I'm going to look at your eyelashes. I don't notice any crustiness, no flakiness, no drainage. All right. And then I'm going to go ahead and look at your sclera and conjunctiva. In doing so, I'm going to ask for you to look up into your, and then go ahead and look down. And I'm going to do the same on this side. Go ahead and look up. Go ahead and look down. In doing that, I saw that his sclera is in fact white. His conjunctiva are pink. I don't notice any drainage coming from his eyes whatsoever. His pupil size is a 3. And next I'm going to perform the red reflex on you. To do so, Eric, I'm just going to ask that you look straight ahead at the window. I'm going to stand about a foot away from him, and I'm going to look for the red reflex in his eye. So I'm going to start with his right eye with my right hand, and I see his red reflex. And then I'm going to go ahead and look for the red reflex with the left hand. Left hand and left eye. And I see the red reflex in there. Alright. Next, I'm going to go ahead and palpate your lacrimal glands. I'm going to grab a pair of gloves here. And I'm going to palpate right in by the inner canthus of both eyes. My fingers. So here I'm going to look for any pain, tenderness, or swelling, which I don't feel. All right. Next, Eric, I'm going to have you go ahead and test your vision using a Rosenbaum scale. This is going to test your near vision. So I'm going to have you go ahead and hold this card, and I want you to hold it about 14 inches away. And then go ahead and read to me the smallest line you can see on the left side.
428739.
All right, very good. Next, I'm going to assess your visual fields through the confrontational test. In doing so, I'm going to check your peripheral vision. So I'm going to kind of stand, and I want you to kind of turn your body a little bit to face me. All right. I want you to cover your right eye, and I'm going to cover my left eye. And then I want you to tell me when you see my fingers.
No. 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 No.
I'll go ahead and cover your left eye, and I'll cover my right eye. Tell me when you see my fingers.
No. 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 No.
Okay. Very good. Next, I'm going to go ahead and assess Eric's pupillary response. And in doing so, I'm going to use my pen light. Alright, so Eric, I just want you to look straight ahead. I don't want you to look at the light, okay? So I'm going to look at his right eye, I'm going to look for constriction, and then I'm going to look in his left eye for consensual response. I'm going to do the same on this right eye. I'm going to look for constriction when I shine the light, and then on the left eye, I'm going to look for consensual response. Alright. Next, Eric, we're going to test your extraocular eye movements, which will test cranial nerves 3, 4, and 6. To do this, I'm going to have you follow the tip of my finger. Okay. And I want you to follow it wherever it goes, okay? So in doing this, I'm looking for any nystagmus or wavering of the eye, which he did, was positive for. Next, I'm going to test your corneal light reflex. I'm going to go ahead and use my pen light again. I don't want you to stare at the light, I just want you to stare out at the window. This corneal light reflex, I'm going to shine on the nasal of his bridge, and when I do that, his eyes should converge onto the light. Alright. And then finally, we're going to practice the cover and uncover test. To do this, Eric, I'm going to stand about a foot away from you. I'm going to have you cover your, let's have you cover your left eye. And then I'm going to have you just stare at the wall with your right eye. And then I'm going to have you go ahead and uncover your left eye. Alright, now go ahead and cover your right eye for me. And then go ahead and uncover your right eye. So in doing this exam, I would do this exam if the patient failed their corneal light reflex exam, and it's going to, again, measure his nystagmus and wavering of his eye. A lot of people are diagnosed with strabismus this way. So next I'm going to move on to the patient's ear exam. I'm going to first inspect the alignment of his ears. Like I did earlier, his ears in alignment with his inner canthus. I'm going to go ahead and inspect this left ear. Again, the ear is in alignment with his inner canthus. Alright. His ear, the skin color looks pink, dry. There's no deformities noticed, no lesions, nothing in that sorts. Next, Eric, I'm going to go ahead and look into your ear. I'm going to change off my cap here, my ophthalmologist scope. Alright, I'm going to go ahead and look into your right ear first. I'm going to pull the ear back and up. In doing this, I'm going to look at the ear canal. I'm going to look for any cerurum. It looks like he's got pink ear. And I'm going to go ahead and look at his tympanic membrane, which looks like it's a pearly gray color. I don't notice any perforations or anything in this ear. I'm going to go ahead and do the same with your left ear. And I'm going to pull your ear back and up. Looking for the same things, looking for any cerurum. Make sure I can see the tympanic membrane, pearly gray color. Alright, thank you very much. Next, I'm going to go ahead and palpate your auricle and your mastoid area. I'm going to look for any bumps, nodules, masses. And then I'm going to go ahead and palpate right behind your mastoid area. Look for any tenderness, swelling. Alright, none noted. Next, I'm going to go ahead and examine the whisper test. I do have to stand about 1 to 2 feet away out of Eric's sight, so I will be off the camera for a second. So Eric, I'm going to go ahead and test your left ear. I want you to cover your right ear. And I want you to tell me what letters you hear me say.
H.
Okay. And now I'm going to go ahead and test your right ear. Go ahead and cover your left ear up.
DKG.
All right. Very good. And next I'm going to go ahead and do Weber test, pardon me. I'm going to go ahead and strike this tuning fork, and I want you to tell me where you hear the vibration, in both your ears or one of your ears.
Both ears.
All right. And next I'm going to perform the brine test. To do that, I'm going to strike this tuning fork, and I'm going to ask you to tell me when you cannot hear the vibration behind your ear. Then I'm going to move the probe in front of your ear, and I want you to tell me when you cannot hear the vibration in front of your ear.
Now. Now.
So air conduction is supposed to be longer than bone conduction, but in this case, air could hear longer on the bone conduction. Next, I'm going to move on to my nasal exam. I'm going to first inspect your nose. Your nose's color is pink. Color is consistent with your ethnicity. I don't see any scaling. I don't see any nodules or masses. Nice and smooth. Your nares don't appear to have any discharge coming from them. They're both oval. I'm going to go ahead and evaluate the patency of your nares, though. So I'm going to have you go ahead and close your right nair with your finger. And then I want you to breathe just normally in and out. And then go ahead and close your left nair. Go ahead and breathe normally in and out. Okay. I'm next going to go ahead and look at your nasal cavity. I'm going to use my pen light for that. I want you to tilt your head back a little bit for me. All right, I'm going to push up on your nose. I'm going to look at your mucosa. Looks nice and pink with some clear drainage. Hairs are present on the turbinates. The septum is deviated to the left side, so more occluded in the right nair versus in the left nair versus the right nair. All right, very good. Next, I'm going to go ahead and palpate your nose. I'm going to look for any tenderness, any masses. And again, I feel that it is deviated to the left side. So next, I'm going to go ahead and move on to my mouth and pharynx exam. I'm going to ask that you keep your lips closed. I'm going to inspect your lips. They're nice and pink. Don't look like they have any scaling, no lesions noted. Go ahead and clench your teeth and kind of smile so I can see your teeth. So, yeah. All right, looks like his teeth have proper occlusion. Nothing noted different with his bite. Go ahead and open up your mouth. I'm going to go ahead and check out your mucosa and your mucous membranes are nice and deep pink, moist. I don't notice any lesions. All right, I'm going to go ahead and pull down here. I'm going to look at your gums. I'm going to look up here. Gums are nice and pink. Again, no bleeding noted, no lacerations noted. His teeth, there's about 32 teeth in here. Looks like they're anchored firmly into his gums. They're nice and white and smooth in texture. Next, Eric, I'm going to put on a pair of gloves. I'm going to examine your tongue and the floor of your mouth. To do that, I want you to stick your tongue out for me. All right. The tongue looks like it's pink, smooth surface. I don't notice any food particles on it, no lesions. I'm going to go ahead and wrap the gauze kind of around your tongue. I'm going to move your tongue side to side. I'm going to look at the bottom of your floor of your mouth, which is nice and pink. Don't feel any lesions, nodules, or masses. Okay. Next, I'm going to look at the back of your mouth. I'm going to look at your hard palate, your uvula, and your soft palate, your tonsillar pillars, and your tonsils. Okay, so go ahead and open up your mouth and stick out your tongue. I'm going to use a tongue blade here. This is just going to depress your tongue so I can see the back of your mouth. So go ahead and tilt your head up for me. All right. Hard palate is nice and dome-shaped and white. It follows into the uvula. The uvula followed right on into the soft palate back there. It looks nice and pink. All right, go ahead and stick out your tongue and say ah. Okay. I saw the soft palate and the uvula rose simultaneously together. I don't notice any mouth odor. And now I'm going to look farther back in your mouth at your tonsils. stick out your tongue wide for me. And just depress your tongue, okay? Alright. His tonsils are a 1+ in between the tonsillar pillars and the posterior pharynx. You can see lymphatic vessels. Alright, that all looks normal. And finally, Eric, I'm going to go ahead and test your gag reflex. Alright, so I'm going to take this cotton applicator and I'm going to stick it in, I'm going to touch the back of your pharynx, okay? And sorry, it's going to be... Alright, next I'm going to go ahead and move on to my neck examination. I'm going to check the symmetry of your neck muscles, the sternocleidomastoid and your trapezius muscles. They look on both sides to be about equal in shape. I don't notice any swelling. The trachea looks aligned, midline here. Alright, nice and smooth skin, pink, color is consistent with his ethnicity. I don't notice any masses, no lesions. Eric, I'm going to have you go ahead and swing your legs into bed and lay back a little bit. I'm going to elevate the head of the bed to 45 degrees. Alright, so the head of the bed is now at 45 degrees. I'm going to check for jugular vein distension on his necks. And I do not observe any. Okay, Eric, you can come ahead and sit back up on the side of the bed for me. I'm going to go ahead and check the range of motion of your neck. I want you to lift your neck up, touch the ceiling, down, chin down to the neck. Alright, back up straight. I want you to turn side to side. And then I want you to turn your heads like your ears touching your shoulder on both sides, and then on the other side. Alright, I'm going to go ahead and apply some resistance. I want you to do the same moves for me. Head back, neck back. Alright. Neck, chin to the chest. Alright. Turn your head to the left. Alright. Turn your head to the right. And then turn your left ear down towards your shoulder. And your right ear down towards your shoulder. Alright. His strength is 5'5", both active and passive range of motion. Next I'm going to go on to palpate, or I'm going to check his shoulder shrug. So I want you to go ahead and shrug your shoulders for me and then come back down. And then I'm going to apply some resistance here. Go ahead and shrug your shoulders for me again and then pull back down. Alright, and that's a 5'5". Next I'm going to go ahead and palpate his carotid artery. Alright, and that's a 3+. Next I'm going to palpate his tracheal position. Sorry, I'm going to kind of get up in your face here. Alright, trachea is midline here. Alright, next I'm going to palpate his thyroid. I'm going to walk behind the side of the bed. So Eric, I'm going to have you go ahead and swallow for me. And when you before you swallow, I'm going to, when you do swallow, I'm going to move your trachea over a little bit to feel for your thyroid gland, okay? So go ahead and swallow. I'm feeling over here first, right thyroid. Okay, breathe. And then go ahead and swallow again. Okay. And palpating this thyroid gland, I did not feel any swelling or tenderness noted. Next, I'm going to move on to palpating Eric's lymph nodes. I'm going to start with his occipital. That's going to be right behind his ears, back at the base of the skull. And then I'm going to move up to test his post-auricle. Alright, and then move up to do his pre-auricle. His mandibular. Submandibular. Submental. And then I'm going to go ahead and move on to doing his posterior cervical. The deep cervical, which is right in the sternocleidomastoid muscle. And then I'm going to do his anterior cervical. Alright. And then I forgot to do my tonsillar. Those are the ones right back here by the mandible joint. Alright. And then finally, to complete this assessment, I'm going to do the auscultate for his carotid and thyroid for bruits. To do that, I'm going to use the bell of my stethoscope. Check in for carotid bruits. I want you to go ahead and breathe in and hold your breath for me. Alright, and breathe normally. Go ahead and take a deep breath in and hold. And breathe normally. Now it's testing his carotid arteries. Now I'm going to go ahead and do his thyroid gland. Listen for any worries here. Alright, and breathe. No bruise heard on his right or left thyroid gland. Next, I'm going to go on to doing inspecting his upper extremity. I'm going to go ahead and look at your hands. Go ahead and extend your hands for me. I'm going to look at his digits. He's got 5 digits here in both of his hands that extend into his forearm properly. His color is pink that is consistent with his ethnicity. I don't notice any lesions, no open wounds or anything on his hands. I'm going to go ahead and test the range of motion of your fingers. I want you to spread your fingers out as far as they can go. Alright, I want you to pull your thumb in like this on both your hands. I'm going to hold them like a fist and then hold them all the way back out again. Alright, very good. Next I'm going to go ahead and palpate your finger joints, okay? Alright, and then on this hand. Alright, very good. Alright, next I'm going to move on to assessing your arms. Your arms the skin looks nice and dry, pink, warm, no moisture noted on both of your arms. The hair is evenly distributed on both of your arms. I don't notice any lesions, no swelling, no open wounds. I'm going to have you go ahead and check your range of motion on your elbows, so I want you to go ahead and bend your elbows about 45 degrees and then kind of let them go next to you. Alright, and then bring them back up again. And then as you're like this, I'm going to have you rotate your hand from the palm down. And then rotate it on in. Do the same on the left hand for me. Alright, very, very good. I'm going to go ahead and palpate your arms just to make sure I don't feel any nodules. Feel any swelling, don't feel any bones out of place. Okay. Next I'm going to move on to your shoulders. I'm going to go ahead and unbutton your gown here. Sit up straight for me. Alright, his shoulders look like they're symmetric with both of his sides, both in alignment. Nice and pink, no lesions noted, no open wounds, no swelling to the eye. I'm going to go ahead and look at the back of you, look at your scapula. Wing scapula look fine, they're in alignment with each other. And then I'm going to go ahead and palpate your shoulders, okay? Make sure I don't feel any bumps or bruises, nodules or masses. None noted. Next I'm going to move on, I'm going to look at your nails. Nails are nice and smooth with a pink undertone on the base. They look like they were just cut. They look nice and clean. Cap refill is less than 3 seconds. Alright, and then I'm going to go ahead and assess your pulses. Sorry, I can go ahead and bump that up for a second. I'm going to assess your radial pulse here. Alright, I'm going to check in this hand. And then I'm going to check your brachial pulse. Alright, very good. Alright, so next I'm going to move on to do your anterior and posterior chest. I'm going to go ahead and inspect your skin both on anteriorly and posteriorly. Do them both at the same time. I'm sorry, I'm kind of untying your gown here. Alright, so the skin on the front part of him looks nice and clean. Little purpura are noticed on his upper chest region. No lesions, no swelling noted, no open wounds. His back, there are a couple of freckles on his back, a couple of purpura are noted. I don't see any open wounds, no lesions. Okay. I'm going to go ahead and go over the thoracic configuration for both his posterior and interior chest. His anterior chest, I can see his clavicular notch here, angle of Louis, his sternum, feel the xiphoid process here, and his costal angle. Right. And then I'm going to go ahead and switch around to the back here. I can see his spinal processes back here. I can see his scapula. And And then next I'm going to go ahead and step back behind him. I'm going to test, percuss and palpate his costovertebral angle. And actually, Eric, I'm going to have you flip around in bed so they can see me do this on camera. So I'm going to first percuss here. And then I'm going to I'm going to palpate, pardon me. And now I'm going to go ahead and percuss. Do you feel any tenderness there?
No.
All right, go ahead and switch back over to the front of the bed for me. All right, and next we're going to move on to assessing the heart and lungs. I'm going to go ahead and inspect his respiration while he's sitting here. It looks even, unlabored, and no acute distress. No acute distress whatsoever. I'm going to go ahead and palpate his thoracic expansion. So to do that, I'm going to go ahead and stand behind you again, Eric. I'm going to place my hands around the 10th rib. I want you to go ahead and take a deep breath in. All right, and let go. Breathe out. And my thumbs raised symmetrically with his breathing in and out, which is a normal examination finding. Next, I'm going to percuss or palpate for tactile phrenitis, both posterior and anterior. And when I do this, I want you to go ahead and say 99 for me. Say 99.
99. 99. 99. 99.
All right. And in doing that, I felt good vibration on his posterior. So go ahead and check your anterior chest. Say 99.
99. 99. 99. 99. 99. 99.
All right. Very good. You passed that. Next, I'm going to go ahead and palpate your precardium. I'm going to go ahead and palpate your apex. And then I'm testing the base of your heart here. All right, and then I'm going to palpate for your apical impulse, which is going to be the left fifth intercostal space midclavicular line. All right, and I feel a strong pulse on that. Next, I'm going to palpate for your infraclavicular lymph nodes. Those are going to be right below your clavicle. And then I'm going to have you go ahead and palpate your lymph nodes underneath your armpits. So I'm going to go ahead and have you hold out an arm for me. And I'm going to go ahead and palpate with the pads of my hands. All right. Expected finding is to not feel your lymph nodes, them not to be tender, painful, or swollen, which is, he's negative for all of that. Next, I'm going to go ahead and percuss posterior, laterally, and anterior. Clearly. Right. Go ahead and flip around back in bed. Okay, and then you can flip back over and face the front for me, please. I'm going to go ahead and percuss laterally. So to do so, I want you to put your arms behind your head. Then you can go ahead and relax your arms. I'm going to go ahead and percuss anteriorly. All right, and very good. Next, I'm going to go ahead and test your diaphragmic excursion. To do so, I'm going to do some more percussion. So I'm going to have you flip back around in bed. I'm sorry, a lot of movement here. I'm going to grab my measuring tape here and some tape. Okay, go ahead and take a deep breath in and hold for me. gonna have you go ahead and do the same. Take a deep breath in and hold for me. You can breathe for me. Okay, so now it's gonna be kind of different this time. I'm gonna have you take a deep breath out, and then you're gonna you're gonna inhale and then take a deep breath out and hold that, okay? Go ahead and breathe in, and then go ahead and exhale. Hold that for me. Go ahead and do the same for me. Take a deep breath in, and then exhale and hold. Okay, go ahead and breathe normally. Alright, so the expected finding is for the distance between the tape to be between 3 and 5 centimeters. So on his left side, he's right around 3 centimeters, and on his right side, right at 3 centimeters. Alright, Eric, you can go ahead and swing your leg. I'm going to take the tape off here. Go ahead and swing your legs back over to the front of the bed for me. Alright, finally we're going to go ahead and auscultate the lungs and the heart. I'm going to go ahead and start anteriorly here. Listen to your lungs. Just go ahead and breathe normally for me. Okay, can you hold your arms over the side of the head like you did before? Breathe normally. Okay, I'm going to go ahead and drop your arms next to you. I'm going to listen to the back of your lungs. Alright, very good. I'm going to go ahead and listen to your heart now, okay? Listen to your aorta. Harmonic. Herb's point. Tricuspid. And your mitral. Next, I'm going to move on to your abdominal assessment. To do that, I'm going to have you lay in bed. Let me get the bed adjusted here. Go ahead and swing your legs in. I'm going to go ahead and look at the color of your stomach. The color is nice and pink, smooth, contour, rounded abdomen, no pulsations or heaves noted. I'm going to go ahead and auscultate for your bowel sounds in all 4 quadrants. And next I'm going to go ahead and auscultate for his arteries. I'm going to start with the aorta. Back to the iliac. I'm going to go to the renal. And I'm going to go to the femoral, which is down in the groin area. In doing this, I'm going to listen for any breweries. None I could hear. Now I'm going to go ahead and percuss his abdomen. The overall should be, on organs, I should hear dullness. Everywhere else in his abdomen should be tympany. And then I'm going to go ahead and percuss his liver borders, which is going to be at the right midclavicular, third intercostal space is where I'm going to start to feel for it. And when it changes to dullness is when I know I'm at the border. Okay, so that's the top of his right liver border. I'm going to go ahead and palpate down the mid-sternal border. Okay, and then I'm going to go ahead and percuss for the lower part of his liver. I'm going to start down more by the umbilicus here. So when it changes to dullness. Okay, right about there on his right lower liver. And then I'm going to go ahead and percuss on the left. Start down by the umbilicus here. Okay, and then I'm going to go ahead and percuss for his spleen. Right over by the mid-axillary line. Press until I hear some dullness. Okay. And then I'm going to go ahead and palpate. I'm going to do some light and deep palpation. Light palpation, I don't want to go any more than 1 centimeter deep. And I'm using the pads of my fingers for that. Alright, and then I'm going to go ahead and palpate for the right coastal margin of his liver border. I'm going to go ahead and put my hand underneath you. I'm going to use deep palpation for this. You don't feel any lumps. Alright, I'm going to go ahead and palpate for his spleen. To do that, I'm going to put my right hand behind the left flank. Palpate with my left hand here. Okay, and then next I'm going to go ahead and palpate for his kidneys. I'm pressing up, I'm sorry, so I can feel your kidney. And press up on your back. Alright, and then I'm going to finally palpate your aorta. Alright, next I'm going to go on to my feet and leg inspection. Eric, go ahead and sit up for me. Turn your leg over to the side of the bed. I'm going to inspect your legs for color. Nice and pink. No lesions noted. The hair is evenly distributed on both of his legs. I don't see any moles, no nicks of any sorts. The nails, I'm going to look at the nails on your feet. Okay. Nails have nice pink undertone. Capillary refill is less than 3 seconds. Cleanly cut fingernail or toenails, pardon me. And also I'm going to look at the muscle mass on his legs. He looks like they're well toned, no atrophy noted. I'm going to go ahead and palpate your temperature on your legs. Feels nice and warm. I'm going to check for some edema by pressing it on the bone. No edema noted. And then I'm going to go ahead and check your pulses. Eric, I need to make sure the video can see it. I'm going to have you swing your legs up on the bed and sit back pretty far. Can you bend your legs up for me a little bit? Perfect. I'm going to go ahead and palpate your popliteal arch underneath your knee. I'm going to go ahead and palpate your dorsalis pedis. It's 1+. 1+. And I'm going to go ahead and check your tibial pulse. Alright, very good. And next I'm going to move on to the neuro exam. Much of the neuro exam has already been completed earlier in this assessment. Cranial nerve 1 is the olfactory. Cranial nerve 2 is the optic. That was already tested earlier. Cranial nerve 3 was already tested earlier with cranial nerves 4 and 6 when I did the 6 cardinal fields of gaze, the pupil size, accommodation, opening of the eyelids. On cranial nerve 5, I'm going to go ahead and test that. Go ahead and clench your jaw, clutch your teeth together. I'm going to palpate. Okay. And then the light sensation was already tested earlier. Cranial nerve 7 was already tested earlier, the facial nerve. Cranial nerve 8 is the acoustic. I'm going to go ahead and test the Romberg test with you. Go ahead and stand up on your feet. I'm going to test your balance. Okay, stand with your feet about as wide as they are to your shoulders. Go ahead and look straight ahead. Alright, I don't notice any dizziness or anything. Go ahead and sit back down. cranial nerve 9 is the glossopharyngeal. On this one, I would test part of the 1/3 anterior of his tongue. However, that's not required for this. Cranial nerve 10 was tested with cranial nerve 9, the gag reflex, and the function of swallowing earlier. Cranial nerve 11 is the spinal accessory muscle, which was already tested earlier with his trapezius and sternocleidomastoid muscle, neck range of motion. And cranial nerve 12 is a hypoglossal cranial nerve. So I'm going to have you go ahead and stick your tongue out. Go ahead and try to touch your tongue to your nose. Touch your tongue down to your chin. Move your tongue side to side. All right, and you went ahead and passed that. Finally, I'm going to test your sensory touch. So I'm going to do superficial touch first. I'm going to go ahead and touch a cotton wisp to areas of your foot and tell me where you feel them. Say
Top
where you
of my
feel
foot.
them. Which foot?
My right foot.
Okay. I'm going to go ahead and test superficial vibration. I'm going to grab my tuning fork. Here it is. All right. Go ahead and tell me where you feel a vibration at again.
Okay. My right foot. My left foot.
All right. Very good. All right. And now I'm going to move on to testing your musculoskeletal. A lot of these I already did earlier. I'm going to test your reflexes. I'm going to get my reflex hammer. I'm going to go ahead and test your brachial first. Go ahead and hold your arm out for me. All right, I'm going to go ahead and test your brachial radial. I have you hold your arm just like that. I'm going to test your patellar. Just let your legs hang. And then finally I'm going to test your Achilles tendon. So hold your leg out, okay? Alright. The cervical spine I already evaluated when I did his head and neck assessment. The lumbar spine, Eric, I'm going to have you go ahead and stand up. Okay. Go ahead and have you bend over, touch your toes. I'm going to check your spine. I don't notice any curvature of his spine. Go ahead and stand up straight and stand back as far as you can. Bend back. Alright, stand straight up. Go ahead and slip your right arm through this. Alright, the shoulder part was already evaluated earlier. Eric, I'm going to go ahead and have you bend your knees for me.
Okay.
Test the range of motion of your knees. Lift one knee up, and then put it on down, straighten it all the way out. Lift up your left knee for me, straighten it all the way out. And then finally I'm going to assess your hip range of motion. So to do that, I'm going to have you lay in bed again on your back. I'm going to have you keep one leg straight. I'm going to have you lift the other one up straight to the ceiling. Alright, let it back down. Raise up your left leg straight to the ceiling. Let that down. Go ahead and bend your right knee for me. Flex that towards your chest. Go ahead and do that to your left leg. Alright, go ahead and bend your right knee for me. Keep your left leg straight. Bend your right knee in towards your left leg. Rotate it back out for me. Go ahead and do the same to your left leg. Bend it in, bend it back out. Go ahead and straighten it. And then I'm going to go ahead and have you cross your knee, right knee while you're keeping your left leg straight like you're going to sit Indian style over the other. And breathe. Very good. Now do the same on the left. Straighten the right leg, cross the left leg. Alright, flip over to your stomach for me. And then I'm going to have you go ahead and raise your right leg for me up to the ceiling. Go ahead and raise your left leg up to the ceiling. Alright, and that will assess his hip range of motion. And this will conclude my head to toe physical examination. Thank you very much.